So the procedure is arterial switch operation. Basically, it is accompanied by VSD closure also because child had an additional hole in the heart. So that is arterial switch means they change the switch over the great vessels. Arterial, that's called aorta and pulmonary artery. They switch over the vessels. That means they exchange the positions, which because the positions were abnormal in the beginning, they made it normal after the surgery. That is one thing. And then they close the hole also. That is the VSD closure. So this would take around 5 to 6 hours, and sometimes we expect some heart failure after the surgery. Luckily, this child did not have significant heart failure. Everything went well very smoothly. It can be some changes in the genes related to changes in the genes. So it can happen unless they are called something called mutations. Mutations, there will be sudden changes in the genes of the babies. So that will happen. That will show in the form of abnormal organogenesis during when the child is in the womb itself, in the mother's womb. So the organs develop in abnormal way. It can sometimes these congenital heart diseases are associated with other anomalies, other problems also, like some defects in the brain or gastrointestinal tract or somewhere else in the body, or any problems in the bones, etc., etc., lung issues. There can be various problems. They're associated with various issues also. But luckily, this child doesn't have any other issues. There's only congenital heart disease, and child is otherwise quite active. No significant intellectual problems. Milestones are all good, and because of the heart disease, child was not gaining weight adequately. Because for a 4-month child, you would expect a weight of around 5 kilos plus. The child was only 4 kilos. It's not too bad, but slightly on the lower side. So now I think the child will start gaining weight after this procedure. We have also given support if one of the children had significant heart failure and heart has stopped after the surgery, and we had to do a CPR. CPR means resuscitation. We pump the heart by doing some compressions on the chest. We did that and put that child on an artificial support called ECMO. Usually success should be around 75 to 80% if if the child is operated early. If the child is operated late, like after 1 year and all, then the heart suffers a lot. Then we need, as I told you before, we have to use additional support systems like ECMO. ECMO is extracorporeal membranous oxygenation, which takes care of which gives rest to the heart while allowing it to recover. And we have used that also in one of the babies recently, but this baby did not require. As the surgery went well, all the post-operative course was quite good, and especially team efforts matter a lot. Nursing care was good, no infections, etc. Everything went well smoothly. Initially, they trouble for a week or two. Sometimes they may trouble for a month also, depending on when they present and how the surgery goes and the type of the disease they have. Even the arterial switch, it's not the same for every child. Every child will have a different post-operative course depending on their own individual factors. But once that sets in, everything settles well. It takes probably a few weeks, and then later they will do well. It should not be a problem at all. So baby is feeding well, and I think baby will start gaining weight from now, and there should not be any more issues. It's a permanent solution.